Hey, Dr. Gardner here at the Vein Institute. Wanted to talk about post-op care. So if you're one of our patients or a prospective patient and you're thinking about having your veins treated, let's talk about what to expect post-op. So basically, we do these procedures in the office. It's an outpatient procedure. Average procedure time takes about 30, maybe 40 minutes. Now, sometimes it does take longer if you have a lot of bulging veins that we have to address, but for the most part, 30 to 40 minutes is kind of an average treatment time. So you come to the office, we treat your veins, and now you're headed home. First off, we give you a worksheet or an instruction sheet to kind of go over, and your caregiver will actually go over this and read this, and they can do that while you're having your procedure. Basically, it's going to give you some detailed instructions about what to do, but I'm going to kind of run through my version of that. So basically, the day of the procedure, I usually have people or patients go home, get off their feet, elevate their legs. I like the ankle to be elevated to the level of the heart because, again, when we sit or stand, blood has to go uphill to get back to the heart. When we lay down, gravity's out of the equation, blood doesn't have to go uphill anymore. We notice decreased swelling. The people that are up and about quite a bit the day of surgery tend to have more swelling and potentially more bruising, so I want people to just go home, take it easy. The only reason I really like people up is to go to the bathroom. And again, the reasoning is you're going to have more bruising and swelling if you're up quite a bit. The problem is patients typically don't have a lot of pain after these procedures, and so what happens is they actually feel pretty good and they get up and they forget and they start doing things. And next thing you know, 2 hours have gone by and their leg's swollen and starting to maybe throb a little bit. So go home, take it easy, get off your feet. We do have you on some medications. I like people to take aspirin. Aspirin is a blood thinner, and so we want that blood thinning effect. I would rather your blood be a little too thin than too thick. Risk of a blood clot with these procedures is exceedingly low, but we always want to decrease that risk by taking an aspirin. We're going to have you on some ibuprofen, 600 milligrams twice a day for a couple of weeks. The reasoning behind that is when we cauterize the vein or laser the vein or use our radiofrequency catheter, we're heating up the vein. We're causing damage to the vein, which will set off your body's own natural inflammatory process. The problem is that you can get a very intense inflammatory reaction around that treated vein, and actually patients can have more pain from the inflammatory response than they actually do from the procedure. So to kind of calm that down, we put you on ibuprofen. A lot of people think it's just for pain, and so they don't take it and they end up having trouble because of the inflammation. So take your ibuprofen. Now, there are some patients that can't take ibuprofen for whatever reason. That's okay. They can take Tylenol, but if you can, we like you on the ibuprofen. A lot of times we'll put you on a blood thinner for a couple of doses. I can't quote you a paper. There's no science behind that. Again, we'd rather have your blood a little too thin than too thick, and so we'll do that for a couple of doses. If that's a concern to you, just give us a heads up and we can talk it out and come up with a solution for you. All we're trying to do is just decrease any risk post-op, which again is very, very low, but there's always risk with any procedure, but we want you to have an uneventful post-op course. We're going to see you back in a couple of days to do an ultrasound to make sure that everything looks normal and there's no problems. Now, let's talk about compression hose. When we put you in compression hose after your procedure, it'll either be a thigh high or a knee high, depending on what treatment we did. Most of the time it's going to be a thigh high. We're going to have you wear that hose for 2 days, 48 hours. So at 48 hours, you can take the hose off, remove the hose completely. Any bandaging underneath you can throw away. Get in the shower, soap up your hands, kind of pat around, scrub the leg. You don't have to be aggressive with it. You may have some small sutures. Those are usually taken out on your first post-op visit, but soap up your leg, dry it off when you get out of the shower, and then put your compression hose back on. You're going to wear those during the day for the first couple of weeks. You can take them off at night when you're ready to sleep. Again, when you're sitting or standing, blood goes uphill to get back to the heart. That's when you want to wear your compression hose because the compression hose help fight gravity. When you lay down at night, there's no uphill battle for the blood, so we don't need compression hose at night after the first 48 hours. Sometimes I'll put an ACE wrap. If we make little bitty 1 or 2 millimeter punctures to remove bulging vein, I will usually add an additional ACE wrap, 1 or 2, to your leg. If I've done that, then again, wear that for the first 24 hours, and you can take it off the next morning after your procedure. Our instructions are pretty straightforward. If there's ever questions or concerns, I want you to call me and I'll answer those for you. You can reach us usually 24/7, but give us a call. Let us know if you have any questions or concerns. Any regular medications you can usually go right back on, and you really don't have to stop anything prior to the procedure other than maybe systemic blood thinners. But if that's a concern, then we need to discuss that ahead of time. So anyway, if you have any questions or concerns, give us a call.